One of the hardest parts of OSCE exams isn't knowing the medicine, it's knowing what to say. Many students freeze during the encounter, forget how to explain their diagnosis, or struggle to present a treatment plan clearly. In this video, I'll show you a simple communication framework with sound bites you can memorize, so you sound organized, confident, and professional in any OSCE scenario. Okay, here's the framework. After introductions, be empathetic of your patient's chief complaint, set the agenda for the visit, provide a summary of their HPI, list your differentials, go over the plan, and don't forget to give the patient a safety net if things get worse. Okay, I know it seems simple, but don't forget the basics, like introducing yourself, your role, your preferred pronouns, and asking that information from your patient. For example, my name is Joan. I'm a student doctor here, and I use she, her pronouns. What's your name and preferred pronouns? And can you tell me your age and date of birth? Juan, can you tell me what brings you in today? Yes, doctor. I've been experiencing chest pain since yesterday. I'm so sorry you're dealing with that, Juan. Let's see if we can figure out what's going on and help you feel better. Don't let your test nerves block your ability to connect with your patient. After confirming their chief complaint, be sure to demonstrate some empathy for their current condition. Step 2 is to set the agenda of the visit with your patient. This immediately makes you sound organized and structured. So this might sound like, to start, I'd like to ask you a few questions about your symptoms, then ask you about your general health, and after that we'll do some focused exams. Does that sound okay? After you've listened to your patient and asked questions about their HPI, pertinent past medical history, and review with systems, show you've been actively listening to your patient by providing a summary. You might say something like, just to summarize what I'm hearing, you've been having abdominal pain for the past 2 days, it's worse after eating, and you've also had some nausea. Did I get that correct? This step also helps you get OSCE checklist points that students often miss. Next, after you've gathered information about your patient's chief complaint, general health, and you've performed focused physical exams, you'll want to move on to differential explanation. And this next step is where many students panic. So take a few minutes to gather your thoughts, and it's okay to let the patient and the grader know you are doing this because it lowers your internal worry about awkward silences. I like to follow this template because it demonstrates you are avoiding the cognitive error of premature closure and anchoring bias. Both are important in practice and OSCE scoring. Here's what that might sound like. Based on what you've told me in the exam findings so far, the most likely cause of your pain appears to be musculoskeletal chest wall pain, especially since the pain worsens with movement and when I press on the area. Other possibilities we want to keep in mind include acid reflux, or less commonly heart-related causes, so we'll continue to evaluate for those as well. Okay, we finally arrived at the treatment plan delivery step. Here's the template I like to use. To help confirm what's going on, Juan, and make sure we're not missing anything serious, here's what I could recommend. And then you can list the different tests, treatments, and lifestyle recommendations you have. For example, I recommend focusing on hydration, gentle foods, and rest. If symptoms persist, we may consider further testing. I think this next step is really important for several reasons. By asking, would this plan work for you? Or how does the plan sound? You are getting patient buy-in, working through any obstacles that might impair their ability to follow the treatment plan, and you're demonstrating shared decision-making. OSCE graders also love this. Many students forget this last step. You want to make sure patients have a safety net between now and when you next follow up with them. So help them understand what are red flag symptoms and what to do if they occur. For example, 1, if you develop severe abdominal pain, persistent vomiting, or a high fever, please seek urgent medical care right away. Okay, so let's bring it all together and show our communication framework in action. Based on your history and exams today, the most likely cause of your pain appears to be musculoskeletal chest wall pain, especially since the pain worsens with movement and pressure. However, we also want to consider other causes such as acid reflux or less commonly heart-related causes. So we'll keep those in mind as we evaluate further. The next step I recommend are rest, anti-inflammatory support, and avoiding activities that aggravate the pain. If you develop worsening chest pain, shortness of breath, or dizziness, please seek care right away. Let's do one more practice example. Based on your symptoms and the exam today, the most likely cause of your abdominal pain appears to be gastroenteritis, which is often caused by a viral infection, Other possibilities we'll keep in mind include food intolerance or irritation of the stomach lining. The good news is this is often improved with supportive care. I'd recommend focusing on hydration, gentle foods, and rest. If you develop persistent vomiting, worsening pain, or a high fever, please seek urgent care right away. Okay, to recap, this 6-step communication framework can help you sound organized and confident during any OSCE encounter. Start with empathy, set the agenda, summarize the history, explain your differential diagnosis, present your treatment plan, and finish with safety netting. Save this framework and practice saying the sound bites out loud. The goal is for your sound bites to feel natural during your OSCE. If you'd like to see more OSCE frameworks and common clinical scenarios, check out the ScrubNotes Chief Complaint series, where we walk through common OSCE cases step by step.